This next speaker is Brigadier Gaurav Kapoor. Though he's not here, he's got an urgent work, so she will be represented by Major Shisti Kuller. She is clinical tutor at Department of AFMC in ophthalmology there. And just to add a few points for Shisti, Shisti is the first person in history of medical, or no, I would say defense services, that she represented. She's the first person from the armed forces to represent the all-lady women contingent on this 26th January. And she was awarded on the spot commendation by the Chief of Army Staff, which is a very, very rare thing to happen. And my congratulations and kudos to Shisti for working almost 2-3 months continuously from morning 3:30 a.m. to night, almost 7 p.m. or so, and marching almost 20 kilometers in a day. So it was a very, very difficult task, but she excelled in that. So, Shisti, now you may please proceed with the presentation.
Thank you very much, sir. So I'll be covering up for Gaurav, sir. So when it comes to any surgical procedure, the right set of skills need to be accompanied with the right set of instruments to have an uneventful surgery. So as we call it, necessity is the mother of all inventions. Dr. Gaurav, sir, applied modifications to the existing design of chopper and dialer, and this was presented at the AIOC2024, which received the best paper presentation in the cataract session and was amongst the top 5 innovations at the Think Under the Apple Tree, and it has already received the patent. So surgeon experience is the most important factor when it comes to outcomes of phacoemulsification. And as reported in the literature, the rate of vitreous complication ranges from 2 to 14.7%. And it is even higher with first-year residents or beginners like me. Even after completing the rate limiting step, as I call it, that is the capsular axis, things can still go downhill during nucleus handling, and especially when it is unsupervised. So the idea of modification of this design was to increase the safety profile and to avoid complications that occur due to the instrument itself, so as to achieve efficacy and efficiency of chopping. So these were the 2 modifications that were done in the existing design of the dialer and chopper, that is 110-degree forward angulation and 20-degree sideway angulation to increase the efficiency. So here's a small video showing that how it helped us to achieve better outcomes. Due to these little modifications in the angulation of the instrument, the axis of the dialer or chopper, whichever one is comfortable to use, aligns with the axis of the phacoprobe, thereby easing out the breakage of nucleus and also preventing the distortion of the port, as you can very well see in this video. So this is the side port sideway angulation, that is 20 degree, and this is 110 degree forward angulation. So in bargain, we achieved increased safety profile of the instrument, reduced complications, and smooth transition to the next step, that is chopping, especially in hard cataracts. And our modified dialers worked equally well as choppers up to grade 3 or 4 nucleus and increased the safety, especially in the hands of beginners. So this is a video in which angle dialer was used for mature cataract, and you can see that minimal manipulation of the port was seen, and the axis of the dialer aligned with the axis of the phacoprobe, and we could break the nucleus very easily. Similarly, angle chopper was used in case of soft cataract, the 3rd to 4th grade of nucleus cataract, and we could achieve the breakage of the nucleus very smoothly. Even in the case of corneal opacity, breaking of nucleus could be easily achieved with the help of this dialer or chopper, and effectively the clear corneal area was used to complete the phacoemulsification part. Here's our use of this instrument in soft cataract cases. As you can see, there is already a crater formation, and how this instrument was used to break the nucleus into 2 halves very smoothly. And this is our last case, a hard cataract. And so easily this nucleus was broken into small pieces with the help of this angulated dialer or chopper, whichever you are comfortable with. Thank you.